We're going to continue looking at our ability to sense things, and we're going to look at the anatomy of the ear, which will give us our sense of hearing, auditory sensation, as well as our sense of motion in space, vestibular sensation. So we'll start with looking at the anatomy of the ear itself and ear structures. Notice we have the two branches of cranial nerve 8 coming away from the structures here. And so we start by looking at the external ear itself, the aural. The aural is made up of the pinna of the ear. The pinna of the ear will include the helix, which is the spiral structure of the ear, as well as the lobes of the ear itself. That's going to allow for funneling of sound into the opening or the external auditory meatus. The external auditory meatus will allow for passage of sound wave through the opening in the temporal bone, which will lead to the tympanic membrane. The tympanic membrane will then lead to the ossicles. The ossicles will then lead to the oval window, which is going to take us into the cochlea. Stemming away from the cochlea is a set of labyrinth structures, the semicircular canals. So the cochlea is going to allow us to have hearing, whereas the semicircular canals, as well as the saccula and utricle, will give us our vestibular sense. We have an open tube that is coming from the middle ear region into the posterior aspect of the oral opening. That is the eustachian tube. The eustachian tube gives an exit to sound wave motion through the middle ear so that we do not have reverberation. It's this pathway that gets blocked up when you happen to have illnesses, such as like a quote-unquote head cold, that leads to muffling of sounds. In terms of the overall structural function of the structures, when we look at particularly what's going to allow us to hear, in this case here, we're looking at things like the tympanic membrane, which is a top band of dense regular connective tissue that is held in place. There is a small muscle, the tensor tympani, which will be coming from the auditory or eustachian tube onto the junction point of the malleus with the tympanic membrane. The tympanic membrane is held in place by a secondary annular ligament that is within the labyrinth of the external auditory meatus. The ossicles themselves are the malleus, the incus, and the stapes. The stapes will articulate with the cochlea itself at the oval window. We then get the helical structure of the cochlea with its scalas, and we get the round window at the distal end of the cochlea. If we go a little bit further into the structures, we end up looking at the cochlea here. The cochlea is going to run from the oval window to the round window. In there we have our scalas, our scala tympani, and our scala vestibuli, which is going to surround the cochlear duct. The scalas are separated by two distinct membranes, the vestibular membrane and the basilar membrane. At the apex of the helix, we get the helocentrum. The helicocentrum is the terminus of the scalas. Sound waves will be moving through the cochlea from the oval window to the round window. We have the saccula and the utricle coming away from the vestibular region of the internal ear structures. Stemming away from the utricle, we get the semicircular canals and the ampulla. Going a little bit more into the structures, we have our structures of conduction with our receptor organ, the organ of Corti. The organ of Corti will be receiving and transmitting sound waves. The ampulla, the saccula, and the utricle will be receiving and transmitting senses of motion. They will all be transmitting information via ganglions, the vestibular ganglions in the case of the vestibular organs, and the spiral ganglions in the case of the cochlea, to the distinct branches of the vestibulocochlear nerve. So let's take a little bit more in-depth look at the cochlea itself. The cochlea itself is going to have two distinct scalas, the scala vestibuli and the scala tympani. This is going to surround the cochlear duct, separated by the vestibular membrane on the scala vestibuli and the basilar membrane off of the scala tympani. Within the cochlear duct, we're going to have the tectoral membrane, which is going to surround the organ of Corti. The organ of Corti is the organ that contains the hair cells that are responsible for our ability to perceive and receive sound waves. Coming away from the organ of Corti, we get the spiral ganglion, and the spiral ganglion will lead to the cochlear branch of vestibulocochlear nerve. Going more in depth here, we're now looking at the organ of Corti itself. The organ of Corti itself is going to be in between the tectoral membrane, membrane tectori, and the basilar membrane. It's going to be made up of distinct support regions, such as the inner rod and the outer rod, which is going to support the cell masses. Surrounding the cell masses are cells that provide support to them. Those are the cells of Dieter. The inner cell and outer cell masses, or inner hair cells and outer hair cells, are the cells that are going to be responsible for receiving sound wave transmissions. They are mechanoreceptors, and they will transmit their depolarization moments to the cochlear nerve for transmission to the temporal lobe. If we look a little bit further into the hair cell bundles themselves, this is what we're looking at. We're looking at a stereocylic organization of projections coming off of the hair cells. These are mechanoreceptors. Mechanoreceptors are set up in such a way that, based off of the deflection that they have towards the apical hair projection, we either get depolarization or hyperpolarization, allowing for transmission of the signal. Each of the hair projections are held in place by what's referred to as a tip link protein. This tip link protein keeps the hairs in unison with each other when deflection takes place. Going a little bit further into this, what's going to allow us to actually perceive sensation, actually receive the information? And this has to deal with what types of sounds we're going to get and what's going to offset the hair cells. And so what we do is we look at how do the stereocylic organizations arrange themselves around the basilar and tectoral membrane, where we can look at how much energy is necessary to allow for deflection to take place, where the higher energy or high decibel sounds are necessary to offset the inner cell mass, whereas the low energy or low decibel sounds are going to offset the outer hair cell mass. When we look at this, what we're looking at is we're looking at how much shear force is necessary in order to get the offsetting to take place, in which we can register that the more sound that we get, the more action potentials we will have coming away from those hair cells. So that's the anatomy of what's going on. So how do we go from that to the neurological pathway that's going to allow us to have the temporal lobe function the way that the temporal lobe is going to function? And so it goes back to looking at how are we transmitting that sound wave. And so sound wave comes in through what's referred as a sinusoidal sound wave. The sinusoidal sound wave will then get compressed into a mechanical sound wave, and the mechanical sound wave will then get transmitted via vibration through the ossicles.